Hello, my name is Dr. Giselle Tadros. I am the founder of In-Home Pediatric PT and Milk Matters PT, and I'm so delighted today to be reviewing the Ecleave baby carrier. It's such a great carrier. It's so versatile, and before I jump in about why I love this one in particular, I just want to talk to you guys a little bit about the benefits of baby wearing. Baby wearing is one of my favorite activities to learn as a new parent because I am a pediatric PT and it is a great tummy time hack. The muscles that the baby uses when they're on your chest actually allow them to strengthen the head, the neck, the shoulders, the trunk. When they're pushing up against you, they're looking up, they're looking side to side, which allows that nice gentle stretch of the neck. So many good benefits in terms of muscle development. But also, baby wearing has been used for centuries all across the world. And in fact, I was first turned onto it when my sister, who works for Doctors Without Borders, came back from Africa and brought me this beautiful, huge, long piece of fabric and told me that this is how moms wear their babies. This was 13 years ago, and so I gave it a try and I was hooked ever since. When you wear your baby, your oxytocin levels increase. That's your feel-good hormone, the hormone that produces breast milk, the hormone that decreases postpartum depression and anxiety, the hormone that allows you to bond with your baby. So that's one of the beautiful things about keeping your baby nice and close to you. It also provides a nice secure attachment because babies can smell you and feel you and touch you, and all the senses. They're growing secure in knowing that their caregiver is close by, and that's how you get that nice secure bond and attachment. The parent's rhythm, the walking, the heartbeat, the talking, it's very rhythmic and it soothes and calms the baby. So when you wear the baby around the house, you will find that your baby is more calm and it learns how to self-soothe from being close to the caregiver. One of my favorites, like we talked about, is that decreased risk of plagiocephaly, which is just a flat head. It allows that gentle movement and stretching of the neck and the muscles to develop. It also prevents what's this new thing out there called container syndrome. Basically, babies, I see so many babies who are delayed in their milestone acquisition because they're being put in all these different containers. A swing, a rocker, a bouncy chair, a snoo, all these different things that prevent the muscles from working and activating. And so being in a baby carrier actually prevents some of that, what we call container syndrome. And decreases the time in that so that you can multitask with your baby nice and close by. And I am a pediatric PT, and so as I say, baby wearing is an amazing hack for tummy time. So babies who hate being down on the floor, try to do tummy time right here on your chest in a baby carrier. I promise they're gonna love it and they will get stronger and tolerate tummy time on the floor in no time. So I've got the Ecleave carrier here. One of my favorite things about it is this little hip thing where you can have your baby sitting on it. What that does is distribute the baby's weight so you're not feeling it as a mom in your back. When you have the baby carrier on, all right, as an aside, I am plus size and I love that this will fit around me and I can wear it with plenty of room to spare. It's good for my psyche and also just good to support my body. So you want this to be down and around your waist, not right up on your lower back, okay? And so this piece right here is sort of this hard hip carrier, and like I said, it helps to distribute the weight for the baby so that you're not feeling the brunt of it all on your back. When you slide an infant in, you want to be sure that their legs form like a nice M position, and that helps to prevent any kind of dysplasia. And this carrier is approved by the Hip Dysplasia Association as a safe baby carrier. So the last thing I want to do is just show you how to get your little baby in here. Of course, my baby isn't going to fuss, but I find that a lot of babies do fuss in that transition, so they feel a little weird and funky getting in. But once they're in, just a little bit of soothing and calming will help them realize how soothing and calming it is to be in here. So you are going to put it on first, all right, and then just slide the baby in. The cool thing about this is everything is adjustable. Okay, so the arms are adjustable, the shoulder straps are adjustable, the waist is adjustable. When you drop your baby in, you want their hands to be up on your chest, okay, and you want their bottom to be on this hip part, okay. And then, as we talked about, you want their knees in an M position. That's what's best for their hip development, okay, to prevent any kind of issues with their hips later. So you want their knees up above their hips in this nice M position, and you want from knee to knee all up against your body. Some babies might have a little bit of tightness in those hips when you put them in that position, and that's okay. Providing them that really gentle stretch is going to really help to support them. The other thing I love about this particular one is that it supports babies from 12 pounds all the way up to toddlerhood. So this is really the only one that you would ever need. This little hip seat here actually comes out, and then also this comes out too. So you can use this hip seat always just to help distribute the baby's weight, so there's never any pressure on your back. I love this, check it out, and thankfully InnoBaby has given me and my followers an amazing deal to test this out. So have a look at it, give it a try. You could always send it back if it doesn't work for you, but I think that you're gonna love it just as much as I do.